Joining us in the studio today is Mike Dugan from FSMB. This is the first in a series of podcasts we're doing on blockchain in the future of regulation, or the state of blockchain at FSMB. Mike, can you tell us about your background and role at FSMB?
Well, thank you, Philip, and it's a pleasure to be here today. I'm the Chief Information Officer and SVP of Operations at the Federation of State Medical Boards. That means I'm responsible for our technology and also much of our operations. As far as my background, prior to FSMB, I worked in hospital technology environments with a focus on electronic medical records. I'm about to celebrate my 8th anniversary here at FSMB, and I would just say that during that time, we have focused on simplifying the use of our systems for all of our users, and our array of users includes physicians, users from our member boards, as well as users in the credential world.
That's great. So, Mike, I always start out every episode asking this question: what is blockchain?
Well, I'll start. My simple answer to that question is that blockchain is a technology that allows transactions to be recorded in a manner that allows them to be independently verified as authentic. So that being said, I would probably add that blockchain is one of, if not the most hyped technologies that I've seen in my technology career. And it's been very interesting to observe this phenomenon over the past year or so. We began internal research on blockchain, or when we began our internal research, the articles were very difficult to read. They were very technical. And when we thought about it, even basic programming would have been very difficult because of a lack of tools. And a lot has changed in a short period of time. And I should point out, I think the reason it's so hyped is because of the promise that it could bring to organizations, and then the whole phenomenon last year with Bitcoin and the value of Bitcoin. So I think those two things coming together, it was even when the World Wide Web came out, I don't know if you saw as much information available. So all of those things has changed a lot in a short period, and if even down to creating code. If you want to create code to do rudimentary functions, it's now very accessible for anybody with a fairly capable IT team. So there are tools from startups, but you can also see household IT names making programming kits available as well. So another thing that's changed in the past year or so is the general understanding of blockchain. And you could ask anybody this same question, and you'd probably get an answer. And whereas recently it might have been, I don't know. But when we started conversations in the past, you had to point out the difference between Bitcoin and blockchain, and then discuss the different types of blockchains. And you really have to do that anymore to the same degree. I'm not saying that everyone everywhere has a complete understanding of those concepts, but there's been enough press and enough information that many people know some of the basics.
Yeah, I give you guys kudos because you're really one of the first organizations to kind of step out and go public with a blockchain pilot and start kind of advertising the world that you were looking at the technology. Healthcare is typically slow to move on innovation, but FSMB was definitely an early mover on blockchain. So when you were doing your initial blockchain research, what was it that really excited you about the technology? What captured your attention, and what potential were you seeing that was a catalyst for making you guys be such an early mover?
Well, our world at FSMB is sort of an overlap of licensing and credentialing worlds. So both of these institutions and their intersection have a great deal of redundancy, which means that there's efficiencies that can be gained. And the redundancies come in the form of verifications and credentialing checks that you see the same checks being performed over and over. So what's exciting to me as much of the technology that blockchain brings to the table is the fact that it has kickstarted a conversation about addressing those redundancies using technology. So I think that's very exciting. I do think that technology can have a great impact on licensing and credentialing. And specifically with this concept of self-verifying or permanent credentials, I don't know that either one of those names has settled in, but that concept, and it's exciting to be part of that conversation.
Yeah, can you kind of explore that concept a little further? And when you say self-verifying credentials, can you explain to the audience what that means?
So, today in the credentialing world, what you see is, and in our world, it's physicians. So I'll address it as physicians, but it could be really anybody that has to have something verified from an institution. But a physician will come to us as an independent verification organization and ask that we go to the institution of record and verify their information. And it could be medical school transcripts, it could be licensure exam transcripts, and then in the licensing world, there are forms that you have to have completed that also include just background information about the physician. So every time that happens, they come to us, and in many cases, we'll get the form verified. And then a physician will move on to a credentialing environment, or perhaps even another state board that doesn't use our service, and that same information will get verified. So the institution, could be the residency program, it could be the medical school, they're going to answer that same question over and over. Whereas with a self-verifying document, you would have a document that stands on its own, and the physician would have ownership of that document. And then they can present the document, and depending on the technology, you can see that it's either you'll run it through a process where the digital fingerprint of that document is verified as authentic, and you would do that at a trusted source, or the document itself would have embedded information and a digital watermark, perhaps, that allows you to verify its authenticity. So that would take out a step in that, what I might say is an expensive and lengthy step in that verification process.
That's great. As you were looking at blockchain, can you walk us through what you did to familiarize yourself with the technology? And can you also talk about what was the hardest concept for you to grasp relative to blockchain?
Sure. I don't know that I remember an exact the exact genesis for this, but certainly there was a lot of hype, a lot of conversation, and I can't remember if we try to stay ahead of technology. I don't know if we have to look into this, or we started perhaps to receive questions from some of our members, what's going on with the blockchain and how does it impact us? So perhaps a combination of the two, we began exploring. And again, 12 to 18 months ago, a lot of the readings were technical. And we did research and tried to put it in a context where we could do and I hate to say pilot, it was really more of a proof of concept demonstration project as much as a pilot. So we were trying to say, how can we put a demonstration project together? When we were doing that reading, I will tell you, there's if you get into the really technical things, there's a number of the things that are concepts that are hard to grasp. But I think in general, the consensus model, or depending on the blockchain that your technology you're talking about, consensus models, combining that, trying to understand mathematically how these consensus models work, but then taking a consensus model and projecting it onto your use case can be very difficult, because typically, it's not that we don't use consensus models like that today. So fitting those two together into a sort of your framework, it can be very difficult.
Awesome. And can you walk us through this project that FSMB did with Learning Machine and talk about the goals of the project, the technology that you guys used, and the process that you went through?
Certainly. Much of the early blockchain material was either highly technical or some of it was even esoteric. And we wanted to cut through all of that and give our members something that would put the technology into context for them. So we selected 2 verification forms, which is our subset of the licensing process and what they do. But we showed them how the verification process for those forms would work using the block search tool, which is the tool provided by Learning Machine. So as important as showing the technology, we wanted to show how the workflow would change when using the technology. In order to do this, we showed a high-level flow chart and then tied that flow chart to individual video steps, so a video each step along the way. And we did a roundtable discussion with members on board and walked through much of it. But we've also posted each step on our website and included scenarios where we modified documents and then tried to verify them so that you can see what happens when you try to forge a document. So we hope that we've broken the process down into consumable pieces that let our members touch and feel the process. And
so what was the role of blockchain in this project?
The role of the blockchain? Well, I think it shows that that independent piece, the blockchain provided the portability of those documents. So using the block search tool, when we present a document, or the physician presents a document, there's a verify button built into the document, and that document takes you to and we built a URL for the demonstration that certify.fsmb.org, so you could see you were going to a trusted site, and then that document was, calculations are performed, and it was a message is displayed saying this is a verified document. So the underpinnings of that verification piece were blockchain.
That's great. Now, the role of FSMB in the state medical boards is probably not going to change, but as we've been discussing, the manner in which the services are delivered are most likely will, especially with blockchain. What can the state medical boards be doing now to lay a solid foundation for this change to occur?
I think it's very important for us to begin having conversations with our member boards, but also with contributing constituents. There's specialty boards, quality organizations, credentialing bodies regarding these new technologies and how they'll be used going forward. And when I say technologies, I mean distributed ledgers, but there's also digital certificates and perhaps digital signatures that will come into play as well. We have seen pilot projects at flagship universities that are either transcript related or diploma related, and I think these projects will have a ripple effect. And to get ahead of this, we need to have a conversation now about how we'll be able to use these technologies going forward, and what are the parameters that will make them acceptable.
So, Mike, it's kind of interesting because you guys did your work on the Bitcoin blockchain. Can you talk about the Bitcoin blockchain and the other types of blockchains that are out there, and how you guys went about selecting the one that you did?
Sure, Philip. That's a very good question. We went with the Bitcoin blockchain primarily because it's the technology that was being used by Learning Machine. Learning Machine had a past with or some success. They had worked with MIT, so they brought a certain credibility to the process. Plus, their tool was developed and pretty far along in the functionality process. I think going forward, and that's sort of where our decision stopped or started and ended. We did not see or haven't made a decision. What's the best technology going forward to provide this functionality? I think that could be a podcast in itself if you want the difference between the Bitcoin blockchain and Ethereum, or some of the other tools that are available, and a public chain versus a private chain. So there's a lot of ground to cover there, but we felt that it showed the technology and it was a good tool to use. So for the demonstration project, we were quite comfortable with it.
One thing I really like about the FSMB strategy was, you identify a technology, whether it comes from your members and partly internally, and then instead of regulating yourself to academic work, you guys made the move to, dig in and actually work with the code and try to build something that people could see. Can you talk about some of the advantages you saw in that model actually doing work relative to just doing more of an academic exercise?
I think it helped us because we saw that, there are tools out there and, what it maybe takes to implement one of the tools. For this demonstration project, the hardest part was coming up with a good set of test data that we could use in a public setting, and then editing the videos, believe it or not. Using the tool was not very difficult. So I think that's good experience for us to have. And as we go ahead and look ahead, perhaps we want to adapt our products and services to use some of these tools that will help us in the future as well.
You've been listening to the Hash Podcast, presented by Hashed Health. Find more content like this at hashedhealth.com, or come to our next meetup and join our growing community of blockchain professionals and enthusiasts. Learn more at hashedhealth.com. Thanks for listening. We'll see you next time.